Hi, I'm Margot Farrell with the Root Center for Advanced Recovery, here to discuss our 2022 to 2023 Clinical Grand Rounds lineup. Our Clinical Grand Rounds is a part of our Advanced Recovery Institute, which is committed to research and training to elevate clinical care. Without further ado, let's get to Chief Medical Officer Dr. Joseph Podolski with more on our featured speakers.
The Clinical Grand Rounds is part of the Advanced Recovery Institute, and we have some nationally and internationally renowned speakers coming to talk about not only hot topics, but their own research. In July, we have Jeffrey Kwame coming to talk about ethics of the therapeutic relationship. And this is important because in therapy, there's a lot of dynamics that are going on between patients and the therapist, and there are opportunities, I think, for things to be done better. And so we're hoping that our clinicians and our providers will be able to learn from his insights with regards to ethics overall. In August, we will have Dr. Zahidi talking about an introduction to correctional psychiatry. I think this is important because a lot of our patients, in one way or another, interface with the criminal justice system. We have a lot of referrals from the Department of Corrections. So I think this will be a good way to learn a little bit more about what goes on behind those doors and how we can best help those patients. In September, we have Kirk Woodring, who will be discussing assessing risk engagement strategies with suicidal individuals. Screening for suicide and mental health in general is critical with our patients. I think it's something that not everybody wants to talk about when they come in for treatment, but by doing it, I think we're engaging folks in making sure that we're providing the safest care and referring appropriate when necessary to higher levels of care. In October, we'll have Dr. Kaminer discussing cannabis harmfulness to youth wellness. And Dr. Kaminer is a child and adolescent psychiatrist at UConn. He's an internationally known addiction psychiatrist. I think this is a great topic. A lot of our patients are using marijuana, and there are negative implications with this in overall mental health. In November, we have Dr. James Greenblatt, who will be presenting The Fats of Life, Understanding the Role of Cholesterol in Addiction, Depression, and Suicide. Dr. Greenblatt is also internationally known in functional medicine, functional psychiatry. This is kind of an emerging science, and he's looking at overall nutritional well-being and how that impacts mental health. In December, we have Youth Suicide, Improving Identification and Prevention, presented by Dr. Rogers. Dr. Rogers is the Medical Director of Emergency Behavioral Health Services at Connecticut Children's Hospital. At Root Center, we're doing a lot of work with adolescent patients, and I think it's important that we really look into suicide risk prevention, specifically with that population, because it is becoming an emerging problem. In January, Dr. Tolan will be discussing cognitive behavioral therapy for anxiety-related disorders. Dr. Tolan is actually also a world-renowned researcher studying a multitude of specialties around anxiety, hoarding. He's had a show on VH1. So I think we'll learn a lot from him and how to address these issues. In February, Marilyn Finkelstein from the Institute of Living will be discussing an introduction to understanding motivational interviewing, how it is useful in working with patients who have substance use disorders. One thing that's challenging at times is patients present in kind of a pre-contemplative state of addiction where they're not entirely sure they want to engage in treatment on a consistent basis, or even if they're willing to go to a higher level of care like a rehab or even an intensive outpatient program. So using motivational skills to be able to engage with patients is critical, and Marilyn will give us some techniques on how to do that. In March, Sarah Becker will be discussing effective but underused contingency management for stimulant use. One thing we have noticed with a lot of our patients is comorbid stimulant abuse in addition to opioid abuse, and stimulants can actually impair the ability of methadone to work effectively. So I think the latest research that she's able to show will be helpful in helping us identify strategies to help reduce use in our patient population. In April, Dr. Alicia Heapy from Yale is going to be discussing using technology to deliver treatment for chronic pain and opioid use disorder, the IMPACT trial. One thing we're seeing is technology being utilized more and more to engage with patients. It can be in the form of an app. It's, I think, expected with a lot of our younger patients, and it helps promote bidirectional dialogue so that you can know what's going on with patients in real time. In May, we have Dr. Giles, who is the CEO of Sonora Health, as well as Dr. McGovern, who's the co-chief Division of Public Mental Health and Population Sciences at Stanford University School of Medicine. They will be discussing, can we harness technology to build trust and adherence in opioid treatment programs? Again, this is along the lines of utilizing and leveraging technology to increase adherence to treatment and then patient outcomes. In June, Dr. Tang Li from the Yale School of Medicine is going to talk about the neural processes underlying alcohol use as a coping behavior. Alcohol use disorder is one of those things that really precludes people from getting the appropriate methadone treatment that they might need. Alcohol works synergistically with methadone and can shut down your respiratory drive. So he's doing some cutting edge research to figure out how to combat opioid use disorder so that patients can be just much more successful overall in their care.
The best news is all of this is free and open to the public, and just $10 if you're looking to receive continuing education units. But those CEUs are free for all Root staff members. If you'd like to learn more or register, you can go to our website, www.rootcenter.org. We hope to see you there. And until next time, I'm Margot Farrell with the Root Center for Advanced Recovery. This video was brought to you by the Root Center for Advanced Recovery and our new Advanced Recovery Institute, where we're investing in research and training to elevate clinical care both at Root and across the country.